Hi, good people. Hope you are doing good. I hope you are doing great. It's another day. I just want us to discuss something concerning STIs and UTI. I know so many people don't know the difference between the UTI and also the STI. When we usually talk about STI, we mostly talk about any disease that is transmitted through sexual intercourse or through sexually. And most of those diseases includes gonorrhea, syphilis, also chlamydia, and also some other bacterial infection. But when we talk about UTI, it's all about the hygiene, or how you take yourself, or how clean you are, what kind of toilets you are using, what kind of tissues, and the cleanliness of yourself or your body. Now, when we talk about the sexually transmitted infection, most of people mix between the urinary tract infection and the sexually transmitted infection. When we talk about sexually transmitted, it means that the infection that you are having mostly comes from intercourse, of the sexual intercourse, which can be spread easily among when you are having more than one partner, or when you are having more than one sexual partner. But when we are talking about the urinary tract infection, those are just infection that comes when you are using, let's say that you are using an infected tissue paper which are not yet hygienically proven. The other case, it's when you are visiting your toilet. There are those toilets which are modern. You know that those who are village people, or village, or those who of us, some of us who are living on village levels, there are those people use the pit latrine, of which that is the best. It is not the best, but according to the modern toilets, which they contain the basin, which contains some water inside. When you go to that toilet and that water on a bad luck gets onto you, when you pee or when you are going for a short call, there are those drops which might jump on you, which can cause that UTI. Generally, the UTI is only the tract infection which is already infected. But when you talk about STI, most of STIs are infections. We cannot the normal UTI, because most of them, they must be transmitted through sexually. So when you are talking about urinary tract infection, and when you are talking about sexually transmitted infection of STIs, there's that difference, of which it can be differentiated by affiliation or a lab tech use of doing the test. Mostly when we are testing for the STIs, there are those diseases which are commonly seen or commonly known. For example, when we are talking about HIV infection, that is one of the sexually transmitted infection. There are those like gonorrhea, which are also sexually transmitted. There is also syphilis, which is also sexually transmitted infection. But when we are talking about the urinary tract infection, we have infections such as candidiasis, which is yeast infection. So when we are talking about the yeast or the candidiasis that can come through the wetness of your private parts, which can lead, or which can encourages the yeast cells to grow or to multiply in a bigger ratio. So when you are talking about the sexually transmitted infection, most of them, and when we are testing them, we can do the microscopy or the commonly done test. We call them serological tests, which include the HIV and also the syphilis. But when we are talking about gonorrhea, that we do a test which is known by the name gram staining. We look for we call the Diprococcus of gonorrhea. But when we are talking about the syphilis and HIV, that can only be done through serological tests, which we use to do the antigen and antibodies. So when we are talking about the STIs or the UTIs, those tests can only be tested through microscopic, so that we can see whether you have an infection through, such as the candidiasis, whether you have an infection like bacterial infection, of which we can differentiate between whether it is through the bacterial infection, and also you can differentiate whether it's parasitic infection. At the most, the most parasitic infection in the urine, that is the Trichomonas vaginalis, which can be seen whether in man or already. And when we usually test those tests, what it's in our mind is to check whether we can get anything or any pathological infection which can give a positive results or a positive conclusion on what the client or the patient is suffering from. So when we are doing those tests, it's better to consult your doctor and inform him or her what you are feeling, so that he or she can differentiate on which test can be done on you, whether it is the serological test that for the STI. Also, there's that parasitic infection that said the Trichomonas vaginalis. That Trichomonas vaginalis is one of the STI. So when you get that infection, it cannot come through the hygienic way, but the most way that can be transmitted of the transmission of that Trichomonas vaginalis, it's through sexually intercourse. So one of the parasitic infections which can be transmitted through sexually, or the STI, is that Trichomonas vaginalis. We're talking about bacteria. There are so many bacteria which can reside or which can cause disease to our urinary tract infection. So when we want to differentiate, we do a test like by the name culture and sensitivity, where we go the bacteria, and later we get the medication for that bacterial infection, and also we do some several antibiotic test. That's the sensitivity of the bacteria, of which we get the medication on which we can give the client, we can give the patient. Guys, continue subscribing to this my channel, continue liking the video, and continue sharing, so that we can learn more concerning our health, and also concerning our lifestyle. You know that so many people might have some questions. Please post them. I'm going to create a video to answer several questions. Continue liking the video, and may God bless you as you do so. Thank you very much for the support, and thank you very much for everything that you have done. Continue sharing and continue liking the video.